Okay, this is my second video. I was ending with digoxin. Next is amiodarone. It's the antiarrhythmic. It's used for the treatment of arrhythmias. VFib, VTAC, AFib. It's a broad spectrum antiarrhythmic. It means it has multiple and complex effects on the electrical activity of the heart. It blocks certain electrical signals in the heart that can cause irregular heartbeat. Amiodarone also causes vasodilation, which makes it also effective for treating heart failure. Examples are amiodarone, chlordarone, and pacerone. Amiodarone increases blood concentration of digoxin, therefore digoxin and dilantin as well. It increases the concentration. So digoxin and dilantin doses need to be cut in half when patients are initiated onto amiodarone. It interacts with Coumadin. It increases the bleeding time. So this can be noticed within the first few days, or it may take several days. So your patients that are on Coumadin are going to have to watch the bleeding time, more so than normal. Treatment for overdose, you treat the heart arrhythmias, fluid resuscitation, gastric lavage, and charcoal. Nitrates, another classification, used in the treatment for angina. Angina is caused by inadequate blood flow to the heart. Nitrates produce vasodilation. Dilation of the veins reduces the amount of blood that returns to the heart that must be pumped. Dilation of the arteries lowers the pressure in the arteries against which the heart must pump. Because of both of these effects, the heart works less and requires less oxygen in blood. Examples: isosorbide mononitrate, isosorbide dinitrate, nitroglycerin in any form, sublingual paste, IV. All of those have the word nitro or nitrate in it. Side effects: headache, orthostatic hypotension, dizziness, fatigue, and signs of hypotension. Side effects are usually dose dependent. If the side effects noted, the decrease in dose is what's needed. More side effects: with the higher doses, the dose comes down some. When applying the patch or paste form, you can reduce the occurrence of headache by placing the patch further from the heart. Serious and fatal effects if it's used with other nitrates such as Cialis, Levitra, and Viagra, which are used for sexual dysfunction. It can cause an abnormal drop in blood pressure and could potentially be fatal. So we have to ask our patients that come in with chest pain and hypotension if they have used any of those nitrates. Let's see, treatment for overdose, rapid fluid resuscitation, treating heart arrhythmias, again, gastric lavage, and charcoal. The next classification is loop diuretics. They work by inhibiting sodium and chloride and water reabsorption in the loop of Henle. Examples: Lasix and Bumex. Side effects: electrolyte imbalance, dizziness, increased urination. It can cause hypokalemia, so patients may need to be put on a potassium supplement. It can cause elevated serum uric acid levels, so we need to routinely check uric acid levels, and also patients need to be taught on or educated on the symptoms of gout. Next, thiazide diuretics. It's used in the treatment of high blood pressure and heart failure. It also works by inhibiting sodium and chloride and water reabsorption, but it is done in the distal convoluted tubule. Examples are hydrochlorothiazide, Losal, and Zerloxolin, commonly used in conjunction with ACE inhibitors for the added effect. Side effects: dizziness, fatigue, increase in urination, orthostatic hypotension. These may also cause hypokalemia. Patients may need to be on a potassium supplement. These also may increase serum uric acid levels, so your patients need to be educated on the symptoms of gout and also have routine serum uric acid levels drawn. Lastly is potassium-sparing diuretics. Same thing, but what they do is aldosterone production causes sodium and fluid to be retained by the kidneys. Potassium-sparing diuretics work by inhibiting the action of aldosterone, causing kidneys to excrete that sodium and fluid, but it allows it to retain the potassium. Examples: amiloride, triamterene, and aldactone. These can be used in conjunction with other diuretics and with high blood pressure medications to prevent hypokalemia. Side effects: dizziness, increase in urination, electrolyte imbalances. It can cause hyperkalemia, so you want to monitor these patients' potassium levels frequently and also monitor for heart arrhythmias. And these are the patients you do not want them to be on a potassium supplement because it will have an abnormal rise in their serum potassium. And again, I don't have time to go over the 16-question post-test that I had done with part of the self-study packet and part of the senior project on my presentation. But it was 16 questions regarding the information that I had presented in the in-service and in the self-study packet. I thank you for the opportunity to do this, and I got a lot out of it. Thank you.